While our repatriation efforts to date have been successful in bringing Canadians home, we must recognize that their journey is not yet over. These fellow Canadians, as you can imagine, have been through a very, very stressful and arduous experience.
For the second time this week, a press conference was held to provide an update of the repatriated Canadians who arrived early Friday to commence their 14-day quarantine at the NAV Centre. The panel consisted of Public Health Agency of Canada Emergency Manager Rhonda Krupp, Eastern Ontario Health Unit Medical Officer Dr. Paul Roumeliotis, NAV Canada Senior Manager of Public Affairs Rebecca Hickey, and Mayor Bernadette Clement, each taking the floor to ensure the safety of the arrived Canadians and the Cornwall community.
We remain very confident that the risk of the novel coronavirus for Canadians and including the people in the Cornwall community remains low at this time. Throughout the process of bringing home Canadians from the Diamond Princess cruise ship, we've taken appropriate actions to ensure a limit of spread of infection and in order to keep the community and Canadians safe and healthy. This included not allowing passengers who showed symptoms or who had tested positive to join the flight today. And those who did show symptoms, as you know, are in the capable hands of the Japanese health system. We're doing what we can to ensure that not only their physical health is taken care of, but their mental health and well-being is taken care of as well. That includes providing social support and mental health services on site.
We're taking the necessary precautions to observe, treat, and contain. And the most important thing that my colleague said here is that in Canada, the risk to coronavirus, this new novel coronavirus, remains low. And I need to stress that it is the same now as it was a week ago before we had these repatriated passengers. The risk remains low, but we are taking every precaution, be it going in, going out of the quarantine area, or in the event of a requirement of an emergency visit to the hospital off-site. All the procedures are in place with our partners in EMS and hospitals locally. The protocols that are in use in Trenton are being used here, and I am actually, again, reassuring everybody here and everybody that's listening that this situation, to me, poses no increased risk, and we are prepared and ready to continue working with our partners.
From our point of view, we felt that we were responsible for answering the call for help. We empathize for these Canadians that have been through quite the stressful ordeal, and our facility is uniquely appointed, as Dr. Paul mentioned. It is a large facility, it is a separate facility, and we have assisted in other government operations, such as evacuations. And from our staff's perspective, a lot of work has gone into preparing for this. We've been working in partnership with FAC, with the Armed Forces, with the Red Cross on site. While our staff will not be interacting directly with the guests, it was an emotional time this morning as we saw these Canadians arrive home.
Mayor Clement was not hesitant to let the media know that the arrival of repatriated Canadians hasn't been easy for the community.
It's also, though, been challenging for Cornwall residents. They have had many questions about how this would affect our city, how this would affect them, their families, their businesses. And I can say at this point, less than a week later, that we have so many more answers than we had less than a week ago. So that is a good thing, and we continue to request, insist on a flow of information, and that is coming forward. So we will continue to work collaboratively with the different agencies on site.
While there's a growing concern for being in proximity of the quarantined individuals, Rhonda Krupp says the public will not be in contact.
At no point will the general public be able to come in contact with the individuals who are in quarantine. Individuals who are providing care or support to those who are in quarantine at NAV Centre are following all appropriate infectious disease procedures to ensure the safety of those within the quarantine and also those who are in the community. As a result, they will not pose a risk to the local community in Cornwall or to others coming and going within the NAV Centre.